Good morning, everyone. I'd like to call our meeting to order. And the first item on the agenda is our roll call. And all commissioners are present other than Commissioner Singh, who has an excused absence. He has another meeting he needs to attend. So we're all here. Can I have a motion for the adoption of our agenda?
So move.
Second.
All in favor? Aye.
Aye.
So moved. And I'd like to ask for an adoption of our September 23rd special meeting minutes.
Move approval.
Second.
All in favor?
Aye.
Aye.
So moved. Now we're going to move on to item 4, Trent Rohr's, our executive director's report.
Thank you, President Khan. Good morning, commissioners. Let me start out. There's not a ton of activity at the state level, and the legislature's in session. Governor's been signing bills, but I'll mention a few items. Let me start at the federal level, though. What's most at interest right now for us is the negotiations around the human infrastructure package. And to see if they can get across the finish line. This is the Build Back Better Act, which has a lot of the human infrastructure pieces that we're interested in that affect our households. They're trying to get a number down that is comfortable for the two Democratic senators who are holding out. And so things have been dropped that we do care about. Things like free community college appears to have been dropped. Some of the expansion of Medicare benefits might be on the chopping block, including dental and vision. Family medical leave could be reduced. Affordable housing could be cut from $300 billion to $100 billion. So we're obviously watching and hoping that a lot can still remain. The expanded child tax credit, we're hoping to see that extended as that benefits our households significantly. So, you've heard, I'm sure the president wants to get something done before he leaves. And so we'll see if something is even done this morning, perhaps. As I said, at the state level, legislature in session, we're beginning to draft our legislative priorities for 2022 and meeting with our state lobbyists next week. And CWDA will be going through that exercise in early December. And it'll be my first month as the CWDA president, which I will serve in throughout 2022. So hopefully we can drive some San Francisco priorities into the CWDA statewide agenda through myself, our advocacy. So just at the state level, what we have done, as you know, subsequent to the budget being passed, the appropriations that affect our department go to the State Department of Social Services, and then they figure out the allocations for individual counties among the programs. So we've gone through the exercise of matching sort of what we had projected in the budget with what we're projected to get from the state, and we've received all of our allocation letters from them. I think we've received all of them. So we're sort of reconciling. We're short on some and over on others, and we think we'll be fine in terms of what we have budgeted. But I do want to bring to your attention 3 particular programs that were significantly expanded under the governor. And we're going to see almost twice as much in some, or 3 times as much in some cases, for 3 housing programs. And these are programs that run through the county human services agencies. So they won't be going through the Department of Homelessness and Supportive Housing, but nevertheless, they're pretty deeply funded programs for families, single adults, and families who are engaged in the child welfare system. The program for families, which is the CalWorks Housing Support Program, we're going to see an increase of a little over 6 million, 6.3 million, which is a doubling of what we currently have. So we'll be through that money, which is used primarily for housing subsidies, also for some related services. We will be able to serve almost twice as many families through that program that runs through CalWorks. In addition, for our single adults who are applying for SSI, who are homeless or who are at significant risk of homelessness, That allocation is going to be about 5.2 million. For context, in prior years, it was a little under 2 million. So that is an increasing significantly as well. And then the third is, well, I should say on that one, we really are working very closely with the Department of Homelessness and Supportive Housing, partnering and trying to work with them to get a portion of their housing portfolio for single adults dedicated to this specific population. We can use this state money to offset what they might be spending locally on housing units. And so we're embarking on a discussion with them regarding that program. And then lastly, Bringing Families Home, which is our program for homeless families engaged in child welfare, for whom homelessness or lack of stable housing might be a barrier to reunification. And so on this one, we're receiving 4.7 million, which is 2.5 times, 3 times as much as the original program. So across all three of these programs, we're excited. We're going to be able to serve a significantly larger number of families and single adults. And we will be working with HSH on all three of the programs. The sort of the referral paths that go into their department. It's kind of another option for them, basically for families. If families are on CalWorks, rather than being served through their programs with a local dollar, they could be referred over to us to be served with state dollars, which is what we always try to do, maximize money that's not local to get a bigger bang for our buck with our local Prop C and other dollars. So this past weekend with our big storm, we did have a bit of a role that the city partially activated its emergency operations center to coordinate the response on severe weather, fallen trees, etc. But our role was, as is typical in a response, is sheltering. And we did partner with the Department of Homelessness and Supportive Housing to activate a pop-up shelter for homeless at Moscone West. This, to remind you, was the shelter we used for COVID as well. We served 114. We had 114 shelter beds full through the weekend. We demobilized it Tuesday morning when the weather was clear, and turned it back over to the Moscone folks that day. So thanks to our disaster response team and our facilities team for making that into a shelter very quickly. A few staffing announcements. As you know, that our three people in our leadership team moved on to bigger roles. Two of them with larger roles in the city and one over in the private sector. Luana Kim was our human resources director, who now is the human resources director for the largest city department of Public Health. And Noelle Simmons, who was our deputy director for economic support and self-sufficiency, is now the chief deputy over the Department of Homelessness. And then Chandra Johnson moved on to the private sector from her communications director position. So I'm very happy to say that we have filled all three of those on a permanent basis now. And I want to announce that our new deputy director for economic support and self-sufficiency is Anna Pineda. Anna was formerly the director of our CalWorks program. And so she's been working in the agency for quite a while in a major program in ESSS, and has really held a lot of roles in our county and different counties, from an eligibility worker to trainer to leading the Kalman effort in Contra Costa County. So very, very pleased to welcome Anna Pineda in her new role. And I especially, I don't know if she can attend today or not, but if she can say hello. But I do really want to express really sincere thank you to Dan Kaplan for doing a fantastic job as acting director for economic support self-sufficiency, while also continuing his role as deputy for admin and finance, taking on 2 jobs in 2 huge divisions in our agency and doing it very, very well. And so Dan, I just want to thank you in front of the commission for that. Our communications director, we have selected a woman by the name of Teresa Young. And Teresa is coming to us from the PUC, and she also from the Joint Information Center under COVID Command, where she had a significant role supporting the San Francisco's COVID response. She was the JIC chief during the initial activation, and has most recently been supporting the city's new vaccine health order, doing comms for them. She was charged with internal communications at the PUC, actually worked alongside our former communications director, Chandra. And so she'll be starting in her new role very shortly, and we welcome Teresa to that. And then lastly, our HR director, I'm really pleased to announce that the person who was serving as interim for the last 6 months was appointed the permanent director, and this is Dr. Katrina Williams. And Katrina was our learning and organizational development manager in our HR division for 3 years, and has worked in social services in our department and elsewhere in Santa Clara for the past 20 years. She's worked in child welfare and SSI advocacy and learning and development, and is certainly well versed in our services, as well as being obviously well versed in the world of human resources. So Katrina, thank you very much for stepping up and taking on this big role. And I'm very happy to have you. So speaking of HR, HR has had an enormous role recently in trying to get our agency ready for reopening, which is happening on Monday, November 1st. Reopening means that we will be back in the office. All staff will be in a minimum of 2 days out of 5. So we're mixing on-site work with telework and mobile work. One of HR's roles has been to certify individual employees' vaccination status. As you know, the mayor ordered months ago that all city employees had to be fully vaccinated in order to return to work on November 1st. As of Friday, we have 92% of our staff are either partially or fully vaccinated. We have about 50 active permanent civil service employees who have not updated their status yet on the site, and we're working with them to get that status updated. The city recently, actually just yesterday, announced that you now don't need to be fully vaccinated to fully work on the 1st, but you need to at least have had 1 injection. And so we're working to sort of refine those rules as we roll this out. But I'm pleased to say that the vast majority of our staff are vaccinated and will be able to work and serve the public, meeting the safety standards that we expect, not only safety for our clients, but also safety for our colleagues and our coworkers. Other big work in reopening, of course, is facilities and also IT. Facilities has been working in our service centers with our supervisors, our managers, make sure that we have plexiglass coverage or the appropriate barriers, the HEPA air filters, ventilation systems that are up to the city standards. IT, significant lift for IT. It was a significant lift when we went to 100% telecommuting and moving to a complete remote and laptop environment for our workers. We're going to have IT staff on site at all of our buildings, sort of roaming around and being available when folks come in to plug in their laptops to make sure they get network connectivity. We have equipment on hand to help staff should they need things like noise canceling headsets, etc. Backfilling monitors, all the hardware, and so a huge lift by them to get us ready and hopefully fully operational on site November 1st. And then our comms team has also been working. They produced a sort of a welcome back or return to work video or a memo, but included a video with our HR director, Katrina, on what employees should expect when returning to the office. That went out on Wednesday, I believe, and has been well received already. And then comms also has been working with our diversity, equity, inclusion, and belonging office and facilities to produce an employee welcome kit for staff. So all staff will be receiving a tote bag, an agency branded tote bag, and a welcome letter from myself and Kelly Dearman, ID badge holder, a hand sanitizer, notebook, and a little food treat as well. So I do want to sort of stay away from communications to thank Joe Malika, who not only has been leading the comms team under Chandra's departure, but there's really just a ton of effort in communicating to staff in a remote environment and doing things like video productions, etc. And Joe really has stepped up in a big way to do that on the heels of having a very significant role at our COVID command center under the city's response. He was at the JIC representing us. So, Joe, thank you for standing in an acting role, but also really thanks for all the great work you've done in the last number of months. Now within our divisions, just a few updates. In our DEIB office, we have done, it's completed now, but for 3 weeks we had an all-staff racial equity survey. The purpose of which is to better understand staff experiences in the workplace, get feedback from them, get their opinions to guide our racial equity activities and priorities over the next year and beyond. We've had a great response rate. Almost 1,250 employees completed the survey. So that's over half of our 2,200 to 2,300 employees. Over the next month, the DEIB office will be looking at the results and beginning to think about what we want to prioritize over the next year and more. On October 6th, DEIB partnered with Family and Children's Services Racial Equity Work Group members. They held an FCS Racial Equity Lunch and Learn, and the theme of it was dismantling systemic racism in child welfare from the inside. So what can we do internally to address what has been a decades-long disproportionality of Black African-American kids in child welfare. It was attended by about 60 staff. Participants discussed disparities in child welfare system and sort of best practices that we might be able to implement to address things like an implicit bias and how it affects our work and exercising cultural competency with clients. On November 3rd, DEIB office will be hosting a virtual HSA employee resource group fair. And this is really kind of to drum up interest and share experiences from staff who are developing employee resource groups. We'll have a panel discussion with reps from employee resource groups at other departments. So SFMTA and the airport, SFMTA's Latinx affinity group, the LGBT SFO affinity group called Out at SFO, etc. So sort of, again, we're trying to encourage formation of these groups at HSA and participation in them. And then in November, the HSA Racial Equity Work Group will conclude its one-year term, and this is the work group that is the representatives are from staff, volunteers from staff, and applications for a new cohort for this work group members will go out and convene a new group in January of 22. It's really just a good way to get sort of staff at all levels of the agency engaged in the work of the DEIB office and helping inform our work in this area. In our workforce development division in ESSS, I just want to update you on a few initiatives that we implemented in response to COVID. One is our Jobs Now expansion. It's really the mayor's increased funding to get mostly small, medium-sized businesses back on their feet, as well as getting people who lost their jobs back into the workforce. In the first 3 months of this fiscal year, we've placed almost 200 people, 177 people in wage subsidy jobs. So these are jobs within for-profit, generally small businesses. We have wage subsidy agreements with 134 employers, meaning they hire from our pool of candidates and get reimbursed for their wages. And across all of our Jobs Now sectors, or tiers we call them, we've placed 498 subsidized and unsubsidized jobs this fiscal year. And that's only through 3 months. So we're at a good pace in that program. Our Digital Divide initiative that we embarked on during COVID, which is to equip clients with laptops, tablets, paired with digital literacy training and tech support. We've served 131 clients through this initiative. So it's really, sort of getting our households equipped to participate in the economy, given that we're so remote now during COVID, but we'll continue to be remote post-COVID. Our initiative to provide cash support for undocumented residents who were not eligible for the federal stimulus funds. We've now provided 470 families with a one-time cash support of $2,500. And again, these are households that didn't get the federal money because of their immigration status. Nevertheless, they're households that need support. So we were able to do that through HSA with local dollars. Another initiative is trying to re-engage our CalWorks families who we sort of pressed pause with during the pandemic, as training classes were suspended and City College was remote and people were not hiring. We've had 78 CalWorks participants received incentive payments for participating in activities. They can earn up to $500 in incentive payments if they participate for 10 weeks. So this is just a way to say, hey, we're moving back open, our training classes and others are going to be are re-enrolling. We want families to participate and take advantage of what we have to offer. And then lastly, our working families credit. As you know, every year we provide the local earned income tax credit through this program. We've made payments to 3,255 approved households. The change we made under COVID was allowing households to get this payment more than once. So we used to say if you got it once in past number of years, you couldn't get it again. Now families can get it again. So it increases, of course, money going into those households. In our benefits programs, particularly Medi-Cal, there was a lot of changes, CalFresh as well, but I'm focused on Medi-Cal here. A lot of waivers to allow households to continue their Medi-Cal coverage, suspending the renewal requirements, delaying any sort of negative action or discontinuances. We currently have almost 125,000 San Francisco households actively receiving Medi-Cal, and they're protected by these waivers, meaning they will continue to get it because the state has suspended those requirements. There's no official date of the expiration of these requirements. We believe it will be at the end of December in 2021, and so we're preparing to have to start doing that continuing eligibility work, but for now we haven't received word. A couple of extensions during COVID. One of them is a postpartum care extension under the federal ARPA Act. California will continue to include an additional 10 months of Medi-Cal coverage following the current 60-day postpartum period for a total of 12 months, effective April 1st, 2022. And then a really big expansion that the state legislature approved under AB Assembly Bill 133 expands eligibility for full scope Medi-Cal to undocumented individuals aged 50 and above. Current law is I believe 60 or 65 and above, but now it's 50 and above. So if they don't have satisfactory immigration status or can't establishment, they can still get Medi-Cal. It's called the older adult expansion, and it will be implemented as early as May 1st of 2022. And right now, we think our sort of local estimate is about 2,700 or 2,750 Medi-Cal recipients are expected to gain access to full scope benefits in May of 2022. So we'll work, obviously, that'll be a lift for us in terms of outreach and contacting households that might be eligible for state Medi-Cal support. CalFresh, a few things, but I want to mention one that's I think most significant, which is the new cost of living adjustment that took effect in October for our CalFresh households. It's the largest increase in CalFresh or food stamps dating back, certainly in my tenure. I'll give you an example. A household of 3 now qualifies for a maximum of $658 a month, compared to $535 a month in 2020. So that's a $123 increase for a family of 3 due to the federal government's increase in benefit allotments, and that increase rolls all the way through from single adults to households of 10. They all see increases that are commensurate with their family sizes. And then in Family and Children's Services, some of you, I know Commissioner Khan has participated in the in-person National Adoption Day event that happens in court. Judge Wiley has canceled that due to COVID. And so we'll be doing a virtual National Adoption Day event, but not the in-person one. And then also we are not going to be holding our in-person resource family holiday event either, but we will be mailing gift cards to our each family, and our protective service workers will be given donated gifts to distribute to their clients during December. So hopefully next year we'll be back on board with that. We are going to have our resource family approval annual review by the State Department of Social Services in early December. That will also be done virtually. So they'll do that really through the information technology system that supports RFA. And then lastly, I know that last month you had a Family First Prevention Services Act, or FFPSA presentation by Liz Crudo and Joan Miller. So part 4 was implemented October 1st, and part 1, which is part 4 was the congregate care piece. Part 1 is the prevention portion of FFPSA, and that will be submitted to this. Our plan will be submitted to the state at the end of October, and we'll be moving forward on how to operationalize prevention activities that will be hopefully federally funded, depending on the type of activity and on the child receiving the services, child and family receiving the services. And then lastly, in FCS, you may recall that during the pandemic, the state froze emancipation for individuals who were non-minor dependents who were being cared for in our system. So these are 21, 22-year-olds. We didn't want to emancipate anyone out of our THP program, our AB 12 housing support programs during the pandemic. However, that has ended, and so at the end of December, we will have 127 non-minor dependents over age 21 who will be exiting care. So these are the post 21-year-olds we carried through the pandemic, and so we're working internally to ensure that to the extent it's necessary, that they have housing options through our various programs and partnerships with the Department of Homelessness and Supportive Housing. But this is the largest number that we will be emancipating at any one time since at least 10 years, probably. And so, we're very happy that we could carry those young adults during the pandemic, but we'll have extra work, as in a lot of our programs, as we resume the activities that were suspended, additional work in making sure that they have stability wrapped around them when they are emancipated. So I'll conclude with that. And of course, as always, open it up to questions or comments from commissioners.
Thank you, Trent. Are there any members of the commission that have any questions of Trent?
I do.
Go ahead, Commissioner Semmel.
First of all, thank you very much for the report. I found it very interesting. And I have a couple of questions for you. When do you think we will come back to meeting in person?
Thanks, Commissioner. Not till January.
Not
That was the latest order. I'm hopeful for January. I think that the latest was the earliest it could be would be January. So Elizabeth will continue to communicate with you on that.
Thank you.
Any other questions from members of the commission? If not, then I'd like to move on to item 5 on our agenda. Is the presentation of the Employee of the Month to Inga Robinson. And I know that Inga's with us, so just bear with me for a minute because I'm going to read all these lovely things about you, Inga. The commission is pleased to announce that Inga Robinson, a court dependency unit clerk with the Foster Care Eligibility Program, is the October Employee of the Month. Inga received nominations from colleagues who aren't even in her unit. She is that helpful. It does not matter what team you are on or who you are, Inga will go the extra mile. When Inga sees something, she says something, stated Candace Seagrove. What she means is Inga is a staff person who holds a great deal of information and possesses troubleshooting skills related to clerical issues. When Inga sees that something is missing or inaccurate, or if someone needs assistance, she helps out no matter what. Inga ensures that the paperwork is done correctly, so foster families and foster children receive timely payments and services to meet their needs. In addition to being a team player and a problem solver, Inga provides excellent customer service and is approachable, friendly, upbeat, and positive. Colleagues shared 3 examples of Inga's exceptional work. Number 1, Inga went above and beyond and contacted me to let me know about a stack of misplaced files from my unit. Now remember, she is not assigned to my unit. She processed the files and ensured they were put in the right place without me needing to ask her to do so. Item 2, when I get into a bind, I don't know how to solve a clerical issue, I can always call Inga to give me directions, and she is very helpful. Number 3, I recently received a call from a client, a grandmother, who informed how impressed she was with Miss Robinson's help and support, even though Miss Robinson was not one of my team members. Miss Robinson took the time to listen to the client, got her the appropriate information, and connected her with me. The client reported that Ms. Robinson was very responsive, helpful, patient, and supportive, making her family's involvement with the department less traumatizing. Recalling various incidents over the 15 years I have worked with Inga, this was not the first time that I have received such calls about her. Ms. Robinson's colleagues all agree Inga is an employee they wish they could replicate and have more of within the family and children's services. She never wavers in her commitment to serve and support families. It is with gratitude and pride that we honor Inga and present her with the October Employee of the Month Award. Congratulations, Inga. And we're going to call on Trent Moore to say some things now, and then we're going to call on you. So Trent.
Well, I'm all for replication. Congratulations, Inga. I just want to say I love when we can recognize an employee for going above and beyond and serving not only families and kids, which is what we're all about, but also our colleagues and people who we work with, whether they're in your unit or outside of. And so just a little bit of recognition for you as Employee of the Month for doing what sounds like a fantastic job. I always think that praise from one's peers is the highest level of praise. And so I'm really pleased to read all the great things they're saying about you. So thanks for the fantastic work on behalf of myself, but also on behalf of all the children and families that we serve and that you've helped personally. So thanks and congrats.
Inga, would you like to say a few words?
Thank you. Thank you, everybody who has supported me. I support you because I feel like my clients are my coworkers, and I just can't stand to see them trying to, be stuck or stressed, or I can't take it. So I do things because I just can't take to see them like stressed or they don't understand how to do something. And if I know, then they ask me and then I figure it out. The situation with Candace, that was funny because I walked past those files for like 4 weeks and I couldn't stand it to see that they were there because I knew that the social worker wasn't sitting there anymore. And so I just but it was weird. You couldn't get to the files. I had to literally jump on top of a desk to get up there to go get the files so that I could reassign them to the next worker. And I just couldn't stand it because I knew it wasn't right. So that's the thing. When I know it's not right, that's when I help. But I also know that we're going through a stressful time in FCS. It's a lot of people stressed out because the work is a lot of work and there's so much detail in the type of work that I do. I'm working with people that are processing details, paperwork for placement, and I just can't every I and every T has to be done correctly. Because if it isn't, it slows down payments, it slows down things happening. It even though it's gone from the other worker, the next worker, it's like passing the baton to the next person. And if it's not right the first time, it's not going to be right to the end. And I just can't do it. So I appreciate everybody who's appreciated me. I do things within reason and I help within boundaries, but I'm going to continue to help you guys because, you know, I care. I make sure that it's right. And thank you again. I appreciate all the support. And back to the commissioners.
Thank you, Inga, and thanks for the great smile.
Oh, you're welcome. Thank you so much.
Okay,
Congrats,
Uh,
Inga. Thanks.
moving on to,
Congratulations, and continue with the joy that you show today. Hey, thank you very much.
okay, moving on to item 6, our consent calendar. Do any of my fellow commissioners want to remove an item for individual discussion? If not, I'd ask for a motion to approve the consent calendar.
So moved.
Second? Is there a second?
Second.
All in favor? Aye.
Aye.
So moved.
Aye.
Moving on to item 7, Cindy Lynn, Food Coordination Manager presentation.
Hi, good morning, commissioners. I will go ahead and share my screen as I have prepared a PowerPoint. All right, is my PowerPoint visible to everyone?
Yes.
Great, thank you so much. So good morning, commissioners. Thank you for the opportunity to present today. My name is Cindy Lynn. I am the manager of the food coordination team here at HSA. Today, I would like to introduce to you our small but mighty team, share some of the work that we've done as a part of COVID-19 response, and what we hope to do this fiscal year to tackle food insecurity here in San Francisco. So a little bit of background on our team. We originated from the COVID Command Center back when we were at Moscone. Our role was to respond to immediate and emergency food needs related to the pandemic. We were first a rotation of disaster service workers, and we have now transitioned to a more stable team. The team is comprised of myself, a nutritionist, program analyst, and 2 additional analysts from the planning and contracts team that are supporting all of our work. Currently, we are focused on sustaining programs that support community recovery and combat ongoing food insecurity. A little bit of information on food insecurity here in San Francisco. We knew that pre-pandemic, 1 in 4 San Franciscans was at risk of food insecurity. Many food insecure residents were not able to apply, or maybe they were afraid of applying for federal food benefits such as CalFresh. And for those who were on CalFresh, many found that the benefits were inadequate since the benefit amounts are decided based on federal income limits and do not reflect the cost of living here in the Bay Area. We also know that immigration status prevents some households from receiving benefits, any at all. We also knew that Black, African American, Latinx, and Indigenous households experience food insecurity at a rate double to white households here in San Francisco. We also know that people of color tend to live in more isolated neighborhoods with additional barriers to food access, barriers including redlining and a lack of reliable transportation. And here in San Francisco, we have many residents who lack adequate kitchens, including about 19,000 SRO residents and thousands of unhoused individuals and families. We know that the pandemic has only made food insecurity worse here in San Francisco. Some research has been done, and there's a prediction that about an additional 45,000 families have experienced food insecurity for the first time during the pandemic. The projected cost to solve food insecurity in a way, or to really meet the gap in people's food budgets, is roughly $100 to $115 million for San Francisco. We also know that debt accrual will soon start to affect many of our residents more intensely. This is due to unpaid rent, medical bills, and a lack of employment in our communities. We also know that many state and federal pandemic relief programs have ended or will soon end. And so we know that there will be additional stressors on our community members. And through communicating with our many service providers, many of them have shared with us that they have not seen a decrease in their programming since the beginning of the pandemic. And so we know that the need remains very high. We're also learning that many of our San Franciscans are seeking food assistance for the very first time. A little bit of historical context on what we did last fiscal year as a part of the city's COVID-19 response. The team was a part of the administration of over $80 million to bring food to the community. We also supported a lot of philanthropy efforts as they wanted to be a part of the solution as well to the increased food insecurity here in San Francisco. We supported a lot of new innovative models of food access, but to share a few, there were the isolation quarantine hotels and also the isolation quarantine hotline. Both options provide individuals and families with food so that they can safely quarantine and isolate at home or at the hotels. We also were a part of the Feed and Fuel program in Chinatown. That is a voucher-based meal program for Chinatown residents who lived in SRO buildings. The vouchers allowed for them to pick up food at participating restaurants in Chinatown so that they could easily access food, but also avoid using their congregate kitchens in the SROs. We also heavily invested in culturally tailored groceries for the Latinx community. We also expanded a lot of delivery options for seniors and adults with disabilities. Two of those include the Great Plates Delivered program and also the Pantry at Home program run by the SF Marin Food Bank, which delivers weekly fresh groceries. We also helped to distribute gift cards and vouchers for SF residents so that they could buy their own food. We know that we will need to focus on ongoing recovery in order to help the community bounce back. And so a part of our work is to continue to support food distribution models throughout the city. We're working with community to support models that reflect the diversity within San Francisco, and really supporting models that highlight dignity, consumer choice, and culturally appropriate options for the consumers. Right now, we are in the midst of finalizing a majority of our current fiscal year contracts, which we hope to begin November 1st, and which are also on the agenda for today. And most importantly, we are learning more about how the pandemic has affected different communities here in San Francisco. In order to learn from service providers, we held 3 listening sessions this summer. Those listening sessions had representation from over 30 CBOs. And it is from those sessions that we have really learned how to inform our current funding strategy. And we are, of course, using all this information gathered and ongoing research in order to shape our future strategies to alleviate food insecurity here in San Francisco. A high-level summary of the community listening sessions that we held this summer. We had 3 sessions, each with a different population focus. One session was just based on general population. One session was based on the immigrant population and their experience in food access. And then finally, the third one was to learn about families with children and how they were accessing food programs. Some of our key takeaways include really hearing from service providers that there's no strong preference over whether their clients prefer groceries or meals. Many meal options were not available pre-pandemic. And so we wanted to understand if giving meals was if it was a good and viable program option. And we learned that there is high demand for both meals and groceries in community. We learned about how important trust is between service providers and their clients. This is especially true for the immigrant population, that the immigrant population do not seek services from organizations that they do not know about or that they do not trust already. We definitely learned about how cultural and linguistic relevancy was very, very important, especially here in San Francisco, where we're very diverse and very multicultural. We also learned the benefits of services that are co-located within one location. It just made it a lot easier for participants and community members to utilize services at the same site. Most importantly, two of our key takeaways here from the listening sessions is to really learn about service gaps. In particular, two were highlighted, and one is the service gap that families with young children face. So oftentimes services are available Monday through Friday, 9 to 5, and that's the same time that many families are, the parents are working as well. So even though they might need additional resources, oftentimes they're not able to go get them because they happen to be working at the same time. We also know that families in particular with younger children, those who are not yet enrolled in elementary school, they do not get the same meal supports because schools often provide meals for school-aged children, but for the younger ones, there seems to be a service gap. And we also learned about the challenges that those who were lacking adequate living facilities faced when it comes to getting enough food, and also particularly COVID mitigation was very difficult for those who lived in SROs, again, because they had to share kitchens and they couldn't safely physically distance themselves from others while they were preparing their food. So we used all this information to inform our funding strategies for this fiscal year. This fiscal year, we have $42 million in our budget, and we hope to provide the most impact to San Franciscans. So 6 of our key strategies. One is to continue to support outdoor pantries. These are called pop-up pantries by the food bank, and their home delivered groceries program for seniors and people with disabilities. Again, so that they can continue to shelter in place safely, but not go with meal gaps. We are also investing in community-led, culturally specific neighborhood pantries. I'll tell you a little bit more about that later on in the agenda as well. We are also supporting the Vouchers for Veggies model, which is $10 worth of vouchers that are given to food insecure San Franciscans, and they can redeem those at about 30 participating grocers throughout the city. We are continuing to invest in prepared meals, again, for the 2 populations that we learned were experiencing some service gaps, and that is for families with young children and SRO residents. Later in the year, we will continue to invest dollars into community kitchens, or commissary kitchens, as they are sometimes called. These are facilities that either currently have or can have the capacity to produce meals for their immediate communities. Examples include church kitchens. We hope to support those models so that they can be a part of the food security foundation here in San Francisco. And then finally, later in the year, it's very likely I might come back to commission and tell you a little bit more about our work on the food empowerment markets. The food empowerment markets are based on an ordinance that was passed July of this year from the Board of Supervisors. This is really a model that highlights and focuses on dignity and consumer choice. So on the agenda today are 3 of our strategies that we are trying to enter into contract. We released 3 RFPs this summer after we held the community listening sessions. One RFP is the Innovative Neighborhood Support that totals $3 million with multiple grantees. The Prepared Meal Support, focusing on families with young children and SRO residents, that also totals $3 million and will have multiple grantees. Finally, the Community Grocery Access RFP, which totals $6.85 million, that also has multiple grantees. This is a high-level summary of each of the RFPs that were released, and these are also the same contracts on the agenda today. For the Innovative Neighborhood Supports grant, we really wanted to support organizations who were already doing the work in their own neighborhoods. A little bit smaller scale, but highly tailored programs who are able to meet the very specific needs of a neighborhood or a certain population. Next is the prepared meal support. This program will be based on a voucher redemption system. So we want to give people vouchers so that they can go pick up their own meals. We are also trying something new with the program for families with young children. And so, as I explained earlier, we learned a lot about how families could not access programming because they simply did not have the time. And so we are seeking to provide meal packs so that people can pick up multiple meals at one time at restaurants so that it could best fit their schedules, as restaurants are typically open beyond the standard Monday through Friday 9 to 5 hours of operation. Finally, we are seeking to enter contract for our community grocery access program here, and these are the larger scale food pantries or food distribution models that go beyond one neighborhood. They go beyond the neighborhood they're located, and they can be they serve multiple zip codes and multiple districts, and they too are hyper-focused on culturally appropriate items, and they offer a lot of flexibility in their schedule. Many of them are open on Saturdays. And with that, that concludes my presentation. I now open it up to any questions that you may have.
Thank you, Cindy. Are there any questions from members of the commission?
I have a question and a comment. I think it's a fabulous presentation and a fabulous program. And my question is how, to my usual one, how are we making it well known in the community so that people can take advantage of it? What kind of PR are we engaged in?
Thank you for that question. So one of the things that we rely on is the established relationships between our community-based partners and their clients. So during the pandemic, word of mouth was probably the best PR. A lot of people just asked around to their friends like, hey, where are you getting food? Where can I get food? Do you know where I can get a specific food item? And they would just share information amongst themselves in the community. What we hope to do is to, through the contracts, grants that we are seeking authorization for today, is to be able to support some outreach budgets for each of our organizations so that they can reach more community members. That can look very different depending on the organization and population. We know that for populations that speak languages outside of English, they might prefer things like WeChat, or even hearing about it from like Facebook. And then it's just very catered to the specific populations they're trying to reach.
Thank you, Cindy. Are there any other questions of Cindy? Seeing none, we're going to move on to item 8, our commission business action items.
President Khan, can I, before we move on, I just want to recognize Cindy and her small but mighty team for leading this effort. This is a really significant increased role for the Human Services Agency in providing food and nutrition support for our communities. And we're typically CalFresh, and then the DOS Department of Disability and Aging Services and their Senior and Disability Food Network. But this is a really huge effort to get food support to families and individuals across the city. And it's new for us, and it's a $60 million investment, and Cindy's at the helm. I just want to thank her for that and a really great presentation.
Thank you, really appreciate it.
Thank you, Trent. Any other comments?
Commissioner Khan, I'd like to make sure that program gets the publicity that it needs. It's so important for the community as a whole to know what's going on. That anybody who's going hungry is an absolute crime and disaster. And we must do our best to make sure that people know what we're doing.
Absolutely. We will definitely make that a high priority with all of our grantees.
Thank you.
And I just want to echo Trent in terms of thanking Cindy and her team and our CBO partners. This is Susie Smith here. We didn't think that they were going to be able to pull off and contracts, be able to pull off these 17 grants in such a short period of time, or maybe it's 18, I can't even keep track. We got this funding approved, Mayor signed a budget in August, and to be able to get this number of contracts, signed, negotiated with the CBO partners, and the thoughtfulness that she and her team brought to this process and seeking community input, and not just sort of continuing what we were doing exactly as we were doing it before during COVID response, but taking the moment to get feedback from the CBO partners and see what other supports they need, which informed our strategy around mini grants for many different organizations. So really heroic effort, and the community has been just amazing in partnering and in serving the need in a very grassroots and responsive way. So just want to echo my thanks to Cindy and team and our CBO partners on this work.
Thank you very much. Moving on to Item 8, our commission business, and I have something to read before we vote. Whereas California Government Code Section 54953 empowers local policy bodies to convene by teleconferencing technology during a proclaimed state of emergency under the State Emergency Services Act, so long as certain conditions are met. Whereas in March 2020, the governor of the state of California proclaimed a state of emergency in California in connection with the coronavirus disease pandemic, and the state of emergency remains in effect. And whereas in February 25th, 2020, the mayor of the city and county of San Francisco declared a local emergency, and on March 6th, 2020, the city's health officer declared a local health emergency, and both those declarations also remain in effect. Whereas on March 11th and March 23rd, the mayor issued emergency orders suspending select provisions of local law, including the sections of the city charter that restrict teleconferencing by members of policy bodies. Those orders remain in effect, so the city law currently allows policy bodies to meet remotely if they comply with restrictions in state law regarding teleconference meetings. And whereas on September 16th, 2021, the governor signed Assembly Bill 361, a bill that amends the Brown Act to allow local policy bodies to continue to meet by teleconferencing during a state of emergency without complying with restrictions in state law that would otherwise apply, provided that the policy bodies make certain findings at least once every 30 days. Whereas while federal, state, and local health officials emphasize the critical importance of vaccination and consistent mask wearing to prevent the spread of COVID-19, the city health officer has issued at least one order, Health Order number C19-07, available online, and one directive, Health Directive 2020-33I, available online, that continue to recommend measures to promote physical distancing and other social distancing measures such as masking and certain contacts. And whereas the California Department of Industrial Relations Division of Occupational Safety and Health has promulgated Section 3205 of Title 8 of the California Code of Regulations, which requires most employers in California, including in the city, to train and instruct employees about measures that can decrease the spread of COVID-19 including physical distancing and other social distancing measures, without limiting any requirements under applicable federal, state, or local pandemic-related rules, orders, or directives. The City Department of Public Health, in coordination with the city's health officer, has advised that group gatherings indoors, such as meetings of boards and commissions, people can increase safety and greatly reduce the risk to the health and safety of the attendees from COVID-19 by maximizing ventilation, wearing well-fitting masks as required, using physical distancing where the vaccination status of attendees is not known, and considering holding the meeting remotely if feasible, especially for long meetings with any attendees with unknown vaccination status and where ventilation may not be optimal. And the mayor issued an emergency order that, with limited exceptions, prohibit policy bodies other than the Board of Supervisors and its committees from meeting in person under any circumstances, so as to ensure the safety of the policy body members, city staff, and public. Whereas the Human Service Commission has met remotely during COVID-19 pandemic and continued to do so in a manner that allows public participation and transparency while minimizing health risks to members, staff, and the public that would be present with an in-person meetings while this emergency continues now. Therefore, be it resolved that the Human Service Commission finds as follows. As described above, the state of California city remain in the state of emergency due to COVID-19 pandemic. At this meeting, the Human Service Commission has considered the circumstances of the state emergency. As described above, state and city officials continue to recommend measures to promote physical distancing and other social distancing measures in some settings. As described above, because of the COVID-19 pandemic, conducting meetings of this body in person would present imminent risk to the safety of attendees, and the state of emergency continues to directly impact the ability of members to meet safely in person, and be it further resolved that for at least the next 30 days, meetings of the Human Service Commission will continue to occur exclusively by teleconferencing technology and not by any in-person meetings or any other meetings with public access to the places where any policy body member is present for the meeting. Such meetings of the Human Service Commission that occur by teleconferencing technology will provide an opportunity for the members of the public to address this body and will otherwise occur in a manner that protects the statutory and constitutional rights of parties and the members of the public attending the meeting via teleconferencing, and be it further resolved that the Commission Secretary of the Human Services Commission is directed to place a resolution substantially similar to this resolution on the agenda of a future meeting of the Human Service Commission within the next 30 days. If the Human Services Commission does not meet within the next 30 days, the Commission Secretary is directed to place a resolution on the agenda of the next meeting of the Human Service Commission, and it's signed by me as the President of the Commission on October 28th, 2021. And I'd like to ask for a motion of approval of this resolution.
So move.
Is there a second? A second?
Second,
All in favor?
Aye.
So moved. Thank you very much. Item B, calling on Cindy Lynn once again. Requesting
Yes.
authorization to enter into a new grant agreement with multiple providers for the provision of community grocery access for a period of November 1st, 2021 through June 30th, 2022 in the combined amount of $6,850,000 plus a 10% contingency for a total amount not to exceed $7,535,000. Cindy.
Thank you, Commissioner. Hello again. I'm still Cindy. On behalf of the food coordination team, we are requesting authorization to enter into 3 sets of new contracts. First is the Community Grocery Access Grant. Sorry, I meant to say grant. Community Grocery Access Grant for a total of $6.85 million for 6 grantees. The second grant is the Innovative Neighborhood Support Grant for $3 million total for 11 grantees. And finally, the third is the Prepared Meal Support Grant for a total of $3 million for 3 grantees. I will begin with this agenda item B, the Community Grocery Access Grants, which funds 2 very important models: large-scale grocery distributions or food pantries, and vouchers redeemable for fresh fruits and vegetables. As I shared earlier in my presentation, we know that food insecurity remains at high levels due to the many stressors brought on by the pandemic. Many community members are seeking food support for the first time ever, and we are hoping to support the ongoing operation of the incredible work of the following grantees. Through our community listening sessions, we know that the demand for supplemental groceries have not decreased at all since the beginning of the pandemic. Programs operated by the 6 grantees will continue to operate their culturally tailored food pantries in the highest need areas with the support of HSA. These organizations will continue to serve our communities with models that are led by consumer choice, dignity, and cultural humility. For the large-scale food pantry and delivery models, we seek authorization to enter into contract with 5 neighborhood-based organizations. The first, Cultura y Arte Nativa de las Americas, for a grant amount of $2.85 million plus a 10% contingency with a not to exceed of $3.135 million. Next is Farming Hope for a grant amount of $200,000 plus a 10% contingency of $20,000 for a total not to exceed of $220,000. Next is Homey for a grant amount of $1.5 million plus a 10% contingency of $150,000 for a total not to exceed amount of $1.65 million. La Raza Community Resource Center for a grant amount of $500,000 plus a 10% contingency of $50,000 for a total not to exceed amount of $550,000. Next, the Tenderloin Neighborhood Development Corporation for a grant amount of $300,000 plus a 10% contingency of $30,000 for a total not to exceed amount of $330,000. University of San Francisco, the University of California, San Francisco for their program EAT-SF for a grant amount of $1.5 million plus a 10% contingency of $150,000 for a total not to exceed amount of $1.65 million. Collectively, the first 5 grantees will be serving over 6,000 households a week with fresh and culturally sensitive food items. Their services will span across the city, but will be focusing on the 9 zip codes with the highest unemployment claims and lowest incomes. For the grocery voucher component of our grocery access grants, we seek authorization to enter contract with EAT-SF, a project of UCSF, for $1.5 million. Vouchers offered by EAT-SF are redeemable at over 30 participating grocery stores across the city and will offer consumers choice over which items they would like to purchase. Not only do the vouchers provide purchasing power for community members, but they also boost economic activity at neighborhood grocers. The impact of this program is demonstrated by extensive research, and we seek to increase the amount of households that they currently serve by 2,200 during this grant term. Since we have multiple grantees in this grant, I have only invited 2 of them to share a few comments regarding their programs, though the rest of the grantees are also present should you have any questions. First, I'd like to introduce Gabriela Aleman, case manager and community organizer at Homey, to share a little bit about their program.
Hi, everyone. My name is Gabriela. I don't know if you can, oh, sorry, my camera was off. And I'm speaking on behalf of Mission Meals Coalition, Food as Medicine Collaborative, and HOMI, HOMI being the fiscal lead on our end. Mission Meals and the above mentioned orgs are a mutual aid collective that includes 25 additional grassroots organizations. Our collaborative programming throughout the pandemic has centered the historically disenfranchised in District 9 and citywide, specifically Central and South Americans and Asian community members. Our work is anchored in removing barriers to access and addressing the food needs of our communities. Our program approach and services are made possible via the following: community pantries, direct food deliveries, curbside pickup, mercados/free farmers markets, community fridges, and for our special food need community members, we have a baby food pharmacy and diabetes food pharmacy. Our community and health specific food programs ensure direct access is provided to local Latinx and API families through a culturally conscious health and nutrition based lens while centering two of the largest populations citywide. Mission Meals Coalition, Food as Medicine Collaborative, and Homies Guerreras de la Ciudad have collectively served as the first responders at the start of the pandemic, and up until now, our operations budget has been grassroots based, but with these requested funds, we will collectively be able to create local job positions, hire a diabetes food pharmacy consultant for our diabetes food boxes, hire a baby food pharmacy consultant for the Mission Minis program, rent and utilities for the home of our community fridge. And lastly, we'll be able to finally compensate the intergenerational work that has fortified our impact in the community via youth and elder stipends. Our requested funds for food will stabilize our citywide mutual aid and will support our collective in solidifying our culturally centered food work in the Lower Mission and Chinatown. Ultimately, our request reflects our longstanding advocacy towards equity in local food work and to ensure the city budget reflects community-led mutual aid efforts to secure two food secure neighborhoods. Thank you.
Thank you,
Thank you.
Gabriela.
Thank you, Gabriela. Next, I'd like to introduce Sissy Bonini, the Executive Director of EDSF.
Hi. Thank you so much for having me, commissioners. I am Sissy Bonini. I'm the Executive Director of EDSF, also known as Vouchers for Veggies. It's a little confusing, but we have both names. Voucher for Veggies is our umbrella name and EDSF is our program name in San Francisco. EDSF was launched in 2015 as a fruit and vegetable voucher program, really addressing the need for affordability and access of healthy foods for low-income San Franciscans in underserved neighborhoods. We have during our program is $20 a month in fruit and vegetable vouchers for individuals and $40 for families. And we were able to serve specific populations such as pregnant people in collaboration with SFWIC, as well as a number of other individuals and families needing healthy food supports in collaboration with our vast network of community-based organizations and clinics that we partner with. Even before COVID, we had a wait list of about 6,000 households for our modest voucher program. But with COVID, of course, the need just greatly expanded. Also, the need for more types of food supports also expanded. So we launched a grocery voucher, which is good for any grocery item except for fruit, alcohol, and sugary drinks. And we were able, what's really great about that program is we're able to leverage our vendor infrastructure and our community-based organization relationships to reach some of the most folks that were most negatively impacted by COVID. So for example, some early in COVID, a lot of Latinx families with with young children were really suffering. We were able to work through our community-based networks to get much needed vouchers out to that population. We also work with, there was a need recently for the Muslim Arab community that was really looking for halal foods, halal meats in particular, and we're able to utilize our voucher program, extend that voucher network for the specialty culturally needs of that community, and really work through a vast network of mosques and community-based organizations to reach those populations. We are delighted to work with Cindy and the city to be part of this response for the emergency food supports in San Francisco that are urgently needed. And as Cindy mentioned, we're really happy to fill that gap that was so much of our clients talk about the choice of foods that fit the dietary and cultural needs of their families, and to really also what's super great about our program is was it designed to also economically support some of these smaller vendors in underserved communities. So it's a win-win-win all around, and we're delighted to be part of the effort. Thank you so much.
Thank you very much. So I believe what I need to do right now is ask for a motion. First off, is there any public comment? Seeing none, then I would request for a motion to approve item B, which requests authorization to enter into a new grants agreement with multiple providers for the provision of community grocery access for the period of November 1st, 2021 through June 30th, 2022, in the combined amount of $6,850,000, plus a 10% contingency for a total amount not to exceed $7,535,000.
So move.
Is there a second?
No, Mr. President, Mr. President,
Yes.
I believe that it would be a better form to approve each grant separately.
So, okay, going on to our next page where it's listed. Are you suggesting that I read each one of those, George, and vote on each one?
Well, if you just take the 6 grants, 6 proposed grantees, and letter them A, B, C, D, E, F for expediency, and consider this let's see, this is item 8B on the agenda, and just make that 8B sub A or something like that. We can go through them quickly, but I believe that it's better form to approve each grantee separately. And we don't have a city attorney here to comment, but I believe that's the proper way to handle this matter.
Okay, so Commissioner
Commissioners, if I
Yamasaki,
may, this is Esperanza Zapian. Good morning, the contracts director. Hello. I
morning.
have consulted with our city attorney as to this particular agenda item, and we can go ahead and just do a single vote to make the process faster. And doing this will comply with our public notice and requirements.
So you've okayed
Okay.
this with the city attorney?
Yes.
And if that is, since that is the case, I wish that specifically noted in the minutes that we're following the advice of the city attorney and handling this as a single in a single motion.
And so that satisfies you, George?
So with that, I will second the motion.
On the question, this is James McCray. when I look at the target population, I can think of no target population than 94124 for the receipt of a grocery store of any activity that would mitigate against the long-term experience of no grocery stores, no fresh fruit, etc. in the Bayview, Hunters Point, and Double Rock community. And as I look at the document, I hear that we're seeking partners that are community-based organizations. And I wanted to know, is there a community-based organization in 94124 that has been sought, identified, and employed in this process, so that we do have not just the written desire, but an actual on-the-ground community-based organization that is seeking to bring fresh fruit to Double Rock, to Hunters Point. I cannot support if I do not know that that's in place.
Hi, Commissioner. Yes, I can address that. So in the current agenda item for this community groceries grant, all of the grantees here will also serve the 94124. So they might be based, centrally based in another another zip code, but they do all serve 94124 with the exception of the grant going to the Tenderloin Neighborhood Development Corporation. In addition, in the next two agenda items, we would like to seek authorization to enter into grant agreements with some organizations specifically based in the Bayview. In particular, we are supporting the Bayview Hunters Point Advocates in their work, which specifically is trying to bring more farmers into the Bayview as food vendors. And they are also going to be working with grocery stores and corner stores for them to provide more healthy options to consumers in the 94124 and general surrounding area. So that will come up in, I believe, the next item on the agenda, but definitely appreciate your comment there. We are trying very hard to work in partnership with the organizations that are in communities most affected.
Reverend McCray, I think that you'll see that on item C, you'll see a list of them, which are, I believe, agencies right in the zip code area that you're speaking of.
Thank you.
So for now, I'd like to ask for a motion to approve the $7,535,000. Is there a motion to approve that?
So move.
Second? A second to that motion? Commissioner Yamasaki or Reverend McCray, are you willing to make a second? Commissioner Yamasaki, you need to unmute.
Okay, am I unmuted now?
Yes.
Okay, yeah, well, as I say, that's fine, we can proceed, but I want to make sure that there is the notation in the minutes that this procedure has been approved by the city attorney.
Yes, that's so noted, and Elizabeth is going to put that in our minutes. So is there a second to approve that?
Second.
All in favor?
Aye.
So moved. Thank you. Moving on to item C, Cindy Lynn, and this is requesting authorization to enter into a new grant agreements with multiple providers similar to above, the provision of innovative neighborhood food support for a period November 1st, 2021 through June 30th, 2022, in the combined amount of $3 million plus a 10% contingency for a total amount of $3,300,000.
Hello again, commissioners. For agenda item C, our next set of grants is in response to the many requests for capacity support that we heard from community-based organizations during our listening sessions. Over 30 CBOs came to our listening sessions, and nearly all of them expressed the desire to continue their food programming because their neighbors were still seeking food support in high numbers. But most importantly, almost all of the CBOs shared that they needed additional support in order to continue the programs. Many had not been properly equipped to operate food programming before the pandemic, and many do not have the staffing capacity in order to meet the demands of the community. Our grants will contribute to not only towards the cost of food, but also towards staffing capacity and also the proper infrastructure necessary to operate food programming. Through these grants, over 6,500 families on a weekly basis will be provided food support by organizations directly in their own neighborhood. Each grantee operates programs that are nuanced and highly culturally tailored. 10 out of the 11 grantees will be directly working to distribute meals and or groceries with our funding, while the Bayview Hunters Point Community Advocates is working to increase the availability of fresh and healthy food items in the Bayview neighborhood. They will do so by connecting retailers to local Black, Indigenous, and people of color or BIPOC owned or led farms, and by supporting stores in the neighborhood to accept EBT transactions. This gives low-income community members increased purchasing power if they are on CalFresh, and also gives them more healthy options to choose from at these retail locations. We therefore seek authorization to enter new grant agreements with the following 11 grantees. Bayanihan Equity Center for a grant amount of $250,000 plus a 10% contingency of $25,000, not to exceed total of $275,000. Grantee Bayview Hunters Point Community Advocates for a grant total of $275,000 plus a 10% contingency of $27,500 for a total not to exceed of $302,500. Next, the Bayview Hunters Point Foundation, which is the fiscal sponsor for United Council of Human Services, for a grant amount of $200,000 plus a 10% contingency of $20,000 for a total not to exceed amount of $220,000. Next grantee is the Booker T. Washington Community Service Center for a grant amount of $300,000 plus a 10% contingency of $30,000 for a total not to exceed amount of $330,000. The Chinese Progressive Association, which is the fiscal sponsor for Excelsior Works, for $250,000 plus a 10% contingency of $25,000 for a total not to exceed amount of $275,000. Next grantee is Curry Senior Center for a grant amount of $175,000 plus a 10% contingency of $17,500 for a total not to exceed amount of $192,500. Next is the Dolores Street Community Services for a grant amount of $250,000 plus 10% contingency of $25,000 for a total not to exceed of $275,000. Next grantee is Fresh Approach for $300,000 plus a 10% contingency of $30,000 for a total not to exceed amount of $330,000. Next is the Glide Foundation for the amount of $275,000 plus 10% contingency of $27,500 for a total not to exceed of $302,500. Next is Homey for $375,000 plus a 10% contingency of $37,500 for a not to exceed total of $412,500. And finally, for grantee SF New Deal, $350,000 plus a 10% contingency of $35,000 for a total not to exceed amount of $385,000. We have representatives from 10 out of the 11 grantees here with us today if there are any questions. But in the interest of time, I have invited representatives from Booker T. Washington Community Service Center and GLIDE to share a little bit about their program. I'd like to turn it over to Shakira Simley, Executive Director of Booker T. Washington Community Service Center, so that she can share a little bit about their innovative program called Service to Soul. I'll turn it over to you, Shakira.
Thank you so much, Cindy Lynn. Thank you so much, HSA Commissioners, Director Rohr, and also to the entire Food Coordination team. You all are fantastic. My name is Shakira Simley. I'm the Executive Director of the Booker T. Washington Community Service Center in the Western Addition, which has served the Black African American community in San Francisco for over 100 years. I'm proud to provide brief comments today in support of the innovative neighborhood food support, which is one of the grant authorizations in front of you today. As a lead agency, Booker T. Washington, working in collaboration with Calvary Hill Community Church, will partner together to establish the Service to Soul program, leveraging our reputations as trusted service providers and standing as Black anchor institutions to reduce food security in the Western Addition, Fillmore, and Bayview Hunters Point communities. Each agency, we already have a robust food distribution programs through weekly meal delivery for seniors, food pantries, and prepared meals for youth and families, and special events for our community. Unfortunately, as we've seen in the COVID-19 pandemic, it's not enough. In order to fill these gaps, the HSA-funded Service to Soul program will meet the critical need for low-income, predominantly Black families, children, and youth to access evening and weekend meals in their neighborhood, employ Black farmers, culinarians, and chefs to nourish our own communities in ways that are familiar, delicious, culturally appropriate, and nutritionally sound. Will create opportunities for volunteerism, jobs, and togetherness in communities of color that have been deeply stressed by racism, toxic stress, poverty, and the health and economic impact of the COVID-19 crisis. And also, we hope to connect families to critical services and resources that we're providing through Calvary Hill and through Booker T, especially through our already established community wellness initiative and COVID-19 interventions. With generous funding from HSA, our partnership will harness the power of two deeply rooted Black cultural institutions backed by strong leadership, community chefs, farmers, a cadre of volunteers to fill a key missing piece of neighborhood food distribution in the Western Addition and Bayview Hunters Point. By sourcing fresh produce from small Black farmers, using community neighborhood-based chef models, and relying on our centers as community hubs, the Service to Soul program will prepare meals using fresh, high quality, locally sourced ingredients and distribute them several times a week. We will corroborate this meal distribution with our community wellness initiative, which offers COVID testing, vaccinations, mental health, and substance abuse resources to our community, which helps create a stronger incentive for community health, wellness, and engagement. Our goal will be to provide food insecure individuals and families with over 30,000 meals throughout the grant period, hopefully more, using this proposed framework. We're super grateful for the support, creativity, and flexibility of HSA to make this community food sovereignty initiative a reality. And I really hope that the Commission approves this grant expenditure so that our communities may be nourished by body and soul. Thank you so much.
Thank you, Shakira. Next, I'd like to turn it over to George Gundry, the Director of Daily Free Meals Program at GLIDE.
You are muted, George.
George, you're muted.
George, I believe you're on mute.
Sorry. Start over. Thank you, Cindy, and good morning, commissioners, for giving me a few moments this morning. I'm George Gundry, the director of the Daily Free Meals Program at GLIDE and the Community Safety Team. Today, I'm going to speak about GLIDE's Zero Waste Food Pantry. Our mission is to support GLIDE's Family Resource Center and the Janice Mirikitani Youth and Child Care Center in the goal of ending poverty within one generation by introducing sustainable practices to address food insecurity and environmental justice. GLIDE's Zero Waste Food Pantry is an extension of our efforts to address food insecurity in the Tenderloin and now beyond. The pantry was born from the knowledge that 93% of our participants in our Family Resource Center lost income because of COVID, and we decided that we needed to do something. The program began as a pilot for a small community, and this generous funding enables us to provide more nutritional and greater variety of goods to an even larger community. This makes us very excited. We're currently serving Middle Eastern, Latinx, and Nepalese families with plans to grow our reach. The pantry distributes healthy bulk items in clean, reusable containers provided by Glide, returned for cleaning, sanitizing, and refilled with pantry items of our client's choice. This is big for us. All items are sourced from local sustainable partners, such as Arcadio's Produce, Panorama Bakery, and Clover Dairy. Some examples of items are chicken, lamb, pork chops, salmon, ground turkey, hello ground beef, healthy snacks for children, seasonal fruits and vegetables, local dairy, local bread, cooking oils and spices. A couple of quick program highlights. We're currently averaging 45 bags containing 230 zero waste containers, with 90 containers being returned each week. Our families are so excited and grateful for this program. They're offering to volunteer putting bags together. So thank you, commissioners, for your time. If you have any questions, I'm available. And Glide is thrilled to be working with HSA. Thank you.
Thank you, George. Commissioners, that includes our grantee speakers. Please let me know if you have any questions regarding this grant.
Move approval.
Whoa, hold on one second. Is there any public comment? Seeing none, then I'd ask for a motion of approval for the $3,300,000.
Mr. President, I hate to be the nitpicker, but I just can't resist. I'm sorry. I just want, first of all, I commend everyone who's participated in this presentation for the excellent work in preparation and the laudable objectives of the programs. And so my alibi for being the nitpicker is that I'd hate to see a problem arise in the future because of the procedure by which these approvals are being handled. So I would ask whether the city attorney has also approved the handling of all of these grantees in one motion.
So,
And further,
Commissioner
all right,
Yamasaki?
we'll take one at a time.
Okay. Go ahead. And further, go ahead. I'm sorry. Commissioner Yamasaki, do you think it would be appropriate for you to have a conversation with the city attorney on our behalf? Because it seems
No, because I don't want to hold anything up. If the city attorney has already cleared this procedure, which to me is extraordinary, that's fine. But I want it reflected in the minutes to that effect. And additionally, I didn't see a table in the memorandum. And an incidental question is HOMEY, wouldn't that be pronounced homey? And that seems to me a more appropriate name than honey.
Oh, I apologize if I misspoke. It is homey.
Okay, that makes sense. But there is no table. And if we proceed with a mass approval, and we've probably spent enough time discussing this that we could have taken everything separately. But since the anticipation was that we would do this on a mass approval, is there a representation that the city attorney has cleared this procedure?
Commissioner, may I make a suggestion? Why don't we just read each of them off individually so that there's no concern here? I mean, I think by the amount of time we're spending kind of discussing it, we could just read each of the grants and the amount.
Well-
for your comfort. Would that be helpful?
Well, we're not being consistent because the
Commissioner Yamasaki,
previous,
Commissioner Yamasaki.
yes,
Let's do this just like we did the prior item, if we could. And we'll have the minutes reflect that the city attorney approved our doing so, and it's consistent with the Brown Act for notification. And
okay, as long as that's noted in the minutes.
we'll note that in the minutes for sure.
Okay.
On each item that we do this.
Okay. It's just a precaution.
So this is how,
Anyway,
this,
I'll move approval of the entire slate.
is there a second to Commissioner Yamasaki's?
Second,
All in favor?
Aye.
So moved.
Commissioners, I believe there are public comments.
I asked for public comments earlier and there were none.
Oh, okay.
Okay, excuse me, are there any public comments now?
Yes.
Okay,
Good afternoon. My name is Daniela Gonzalez. I am the union representative for HSA workers, SEIU 10-1 representative. I'm here, commissioners, to present a petition that we will be submitting to the commission and to Executive Director Trent and to Mayor Breed, with hundreds of signatures from HSA workers who have signed our petition to demand that HSA management put safety first by minimizing in-office rotation.
President Khan, this isn't
Yes.
related to the agenda item. This should be saved for general public comment. So Ms. Gonzalez needs to wait for general public comment at the end of the meeting.
okay.
Okay.
Can I have a motion to approve?
so move.
Is there a second? Is there, George, are you making a second?
What is the
I was
motion?
under the impression we've already voted on this.
We voted on the motion before.
Yeah, it's not necessary to do it again.
Okay, so then moving on to,
Gee,
no, moving on, we approved the $3,300,000. This is, now moving on to item D. This is, we're voting on item D now. Hold on.
Commissioner Khan,
Okay, moving on to item D. Is there any public comment? If not, then I ask for a motion to approve item D for $3,300,000.
so move.
Is there a second? Is there a second to item D, $3,300,000?
I'll second.
All in favor?
Aye,
So moved. Now we're moving on to item E. Requesting authorization to enter into a new contract agreement with the County of Ventura for provision of membership to the California Ventura Automated Collection System Association for the period of July 1st, 2021 through June 30th, 2026 in the amount of $75,000 plus a 10% contingency for a total amount not to exceed $82,500.
Move approval.
No, we have to have the presentation first. So calling on Joseph Quartel. Did I pronounce that properly?
Yes, you did, Commissioner.
Thank you.
Good morning, Commissioners. This contract is a contract with the County of Ventura and the consortium called the California Vax Association. It's a 13-county consortium that shares fiscal and technological knowledge with regards to the administration of overpayments in San Francisco County and the member counties. Currently, our biggest project is the transition to the CalSAWS automated welfare system when we go live in the fall of 2023. This system covers our accounting and reporting for collections, business intelligence, and revenue management fiscal functions. It is a agreement we've had since 2009. However, in the last couple of years in discussions with the city attorney and the Office of Contracts Administration, they felt that it was best that we go into a long-term contract. And therefore, that's why we have this before you today for 5 years, $15,000 a year, for a total of $75,000 with a 10% contingency of $7,500. Do any of you have any questions that I can address?
Is there someone in the Ventura office and all of the other offices and in ours who monitor this together? I mean, how does that administration go between the various groups?
Okay, Ventura County IT Services is responsible for the software product and its support.
Okay. That's good. That lets me know where that lodges. Okay, thank you.
Move approval.
Is there any public comment? And I ask for a motion to approve.
Move approval.
Is there a second?
Second.
All in favor?
Aye.
So moved. Thank you very much, Joseph. Moving on to public comment. Is there any public comment?
Yes.
Daniela Gonzalez?
Yes.
Okay, go ahead with your public comment.
Okay, thank you very much, and I apologize for earlier. I thought it was public comments. So again, my name is Daniela Gonzalez. I am the union representative for HSA workers from SEIU 10-1, and I am here to present a petition that hundreds of HSA workers have signed to demand HSA management to put safety first and minimizing in-office rotations, maximizing telecommuting, and really encouraging and allowing all virtual work functions to be performed safely from people's homes so that they can protect their families and themselves from COVID-19. We will be submitting the petition today to the commission, Director Trent and Mayor Breed. And I'm sure there's more HSA workers here to talk about the petition itself. Thank you very much.
Thank you very much. There are no other public comments, so I move for adjournment.
Oh, my hand is up for a comment. I have my hand raised.
Go ahead.
Jesse Stanton. Hi, my name is Jesse Stanton. I'm a worker, eligibility worker at HSA at 1440 Harrison, and I'm a member of SEIU 10-1. I'm going to just read the whereas in this petition here. It's addressed, Dear HSA Management, during the COVID-19 pandemic, HSA and city management have made unprecedented changes to policies, procedures, wages, hours, and working conditions affecting all of us. These changes have caused extreme and undue stress and anxiety for our members. They have negatively affected our health, both mentally and physically. Management is often changing our schedules, assignments, and regular functions without planning, support, training, or proper notice. Now the agency is preparing to arbitrarily and capriciously return us to a hazardous and unsafe work environment fully and unnecessarily exposing us to COVID-19 variants. HSA management has additionally taken unilateral actions that jeopardize our health and safety, including but not limited to, we'll go on with assigning vulnerable employees to hotel sites. These are housing clients who are COVID positive and employees have been exposed and are still awaiting test results. Putting workers on unpaid leave for declining the high-risk assignments over fear for their health and even their lives. Failing to agree to have stricter worksite sanitation protocols, conducting adequate COVID-19 tracking procedures, and agreed to maintain distancing standards. I believe my time is almost up, but I think another one of my colleagues will jump in to carry on the rest of the petition. Thank you.
Thank you. And who would like to speak now? I can't see who has their hand up. Anybody else want to speak?
I would, yeah, if I could, thank you so much. So basically, let me share that just very quickly, I've been multitasking. I have approved CalFresh and CalWorks for 3 families during the process of your meeting. I'm impressed with the level of detail and the care that the board brings and our staff brings every day. I speak on behalf of eligibility workers and others at CalWorks who are asking management and the commission to spend a little bit more time focusing on the stress and the fears of workers, frontline workers who are tripling or doubling their time in office. Now, I found it quite interesting that the state of the emergency remains in effect, was mentioned earlier, and the commission is delaying any public in-person meetings for staff until January. Might there be some consideration of reducing the planned return to work schedules to minimize the risk to our staff? Just moments ago, a coworker sent me a note saying that Uber prices have risen and she fears riding BART to work every day. But note this, our staff is as committed as ever to meeting the needs of San Franciscans. We just ask if the commission and our agency can pay a little bit more attention to the fears and the concerns expressed by the frontline workers who have been on the job since March of 2020, meeting the need of San Franciscans. Thank you for your time.
Is there any other comment?
Yes, I'd like to speak if I may. Yeah, my name's Cesar Love. I work for HSA out of the office at 3120 Mission Street. I'm in 9704. And I've been volunteering to come in to the office 5 days a week since I got reassigned here last August. And there's been very few people here. Almost everybody has been telecommuting. And one of the great things about that is that nobody who has been assigned to work at 3120 has come down with COVID, because the management staff here has emphasized just maximum telecommuting, and that has worked. It has kept the staff here safe. And I think that's a good example of how telecommuting has kept the staff safe, and the work has gotten done. They've looked at the numbers, and the work has been, people are able to work at home and get the job done. Return to work doesn't seem wise at this time, because it's proven here at 3120 that telecommuting has been effective, not only for the productivity of the job, but for keeping people safe. So, I'm asking that, we continue it, and the union's asking that we continue it. I've been happy to come in here at the office. There's only a few people here. I felt perfectly safe. And those of us who've been in the office have just, have kept safe, because there's so few people here, but that's due to change come November 1st. So just wonder if we could just go back to maximum telecommuting. Thank you.
Any more comments? Mr. Rohr?
President Connor, would you like a response?
Yes.
Just want to clarify for commission purposes that this is not, even though one of the speakers characterized it as a unilateral HSA decision, this is a citywide decision to return to work on November 1st. A decision made by the mayor, by the head of the Department of Human Resources at the city, as well as the city administrator, Carmen Chu. the assurances and the safety that some of the employees talked about, the mayor is very mindful of, which is why she's requiring every single employee to be vaccinated in order to return to work. She and the director of the Department of Public Health, as well as the city's health officer, all feel it's safe to return to work. I want to remind the commission that we were initially scheduled to return to work on September 1st. And the mayor and the other city leaders I mentioned all decided to delay it out of concern over the Delta variant. The COVID numbers right now are as low as they have been since prior to Delta. The city is uniformly moving forward with return to work on November 1st. And then my last comment is just to remind the commissioners, as I mentioned in my report, the return to work is a minimum of 2 days out of 5, or 40%. And so the majority of our employees' work will continue to be done via telecommuting or mobile work. And the citywide requirement is 2 days a week, or in some cases 40% with staggered schedules. And that will, to Mr. Love's concern around office crowding, because of the staggered schedules, the offices will not be at 100% capacity. They'll be at less, given the 2 days out of 5 that people will be in.
Thank you,
Mr. Rohr. Mr. Rohr, James McCray.
Commissioner McCray.
What are the internal procedures we use to handle our staff's disaffection? And then number 2, what are the ways that we're communicating? What are our limits? What are our boundaries? What we must do so that we have that kind of clarity out there?
Sure. What we sent out, my office, as well as Director Dearman's office from DOS, a return to work memo yesterday that went to all staff, and it included a video from our Human Resources Director, Katrina Williams, walking through exactly how people should be conducting themselves in the workplace beginning Monday, in terms of respecting people's space. Masking is still required indoors, even though the health order has relaxed that in office settings. The Department of Human Resources has not yet issued guidance around that. We have our sanitization stations as well that are on every floor, so people can wipe down their desks, etc. I think that people are really, I guess, sadly, since it's been over a year and a half of COVID, are used to masking and distancing, and it's sort of the way that we're doing work. And again, because we're at reduced on-site capacity, because we're maintaining telecommuting throughout the agency, there will be naturally more space. Mm-hmm. And I'd be happy, commissioners, because it was actually, I thought, quite well done, forward you all the memo and the video that went to staff on Wednesday. You'll gain an appreciation for all the steps that we're taking as we return to work. I think lastly, I want to leave it with, we are, although I think staff and certainly leadership and you commissioners know that the safety of our employees is of paramount concern, and for me, but the other priority, of course, for us, and I would say the number one priority, is serving the public. We are a critical agency during the pandemic, providing benefits, safety net services to people who are desperately in need. The applications for our benefits are increasing. We will soon have to resume a lot of the eligibility certification work that the state had suspended during COVID. So we will see increased demand on our services. And some people who take advantage of our services want to be assisted in person. And we have to be able to provide that. And so we need to be flexible. We need to be on site if people need and feel more comfortable. If language is an issue, if whatever reason, comfort, then they want to be served in person, it is our obligation to serve them in person. And in order to do that, we will need people on site. In addition, there are some functions, notably in workforce development, where services are more effective in person. If you're going through interview practice, going through working with someone's resume, helping them find a job, it's often much easier to do that when you're working with someone in person. And for that reason, some of those staff might be on site more than just 2 days a week. And then I'll just conclude with, I feel very comfortable with our plans for returning to work. in terms of balancing the safety of employees as well as really equipping our agency to provide the best services possible to the public.
Thank you, Trent. Is there any other public comment? Seeing none, then our meeting is adjourned.